the movement, and I will see you there.
All right, good afternoon and good evening, depending on where you're joining us from. Thank you so much for joining today's webinar. We'll just give a few more minutes for our other colleagues to join. You can see we have quite a number of people in the waiting room. So please give us about a minute to allow everyone log in and join the session. But thank you so much for being here. We're super excited to have all of you on the call. This it's 4 p.m. on my side, so it's like late afternoon towards evening here. I hope you've all had a very good week and a good Friday. So please, just to ensure we know we have an understanding of our participants today, you can please just drop your name and where you're joining us from in the chat very quickly. And also, I'd like to also do a quick climate check since we're all here to discuss about climate and healthcare. You can drop in the chat where you're joining us from and one emoji for what how your weather is actually at the moment where you are right now. So if you can pop in the chat an emoji that signifies how the weather is at your end at the moment, to give us a sense of how we're all doing today, where we're joining from, and how is the weather on your side. So please just drop that in the chat very quickly. Thank you so much for joining us. You are on the flagship webinar for Africa Climate Change and Health Week 2026, organized by Digital Health Africa. If this is your first time joining us for the Africa Climate Change Health Week, welcome. We are glad you found us. And if you have been with us since 2024, welcome back. And thank you for building this with us. So we'd like to see your introduction in the chat very quickly before we kick off the program. And I hope I'm audible. You can give me a thumbs up if you can hear me clearly. Great, great, great. Thank you. Amazing, amazing. Thank you all. So please pop in the chat where you're joining from, your name, what you do, and an emoji that kind of signifies how the weather is at your end. If it's very sunny, you can put that very nice sunny emoji. Oh, I can see add more. What's going on? I'm not sure what your emoji actually means. Is the weather? I don't know what that means for how your weather is like on your end from Zimbabwe. So please do pop in an emoji to show how the weather is on your end. Thank you. Oh, Maxine, I can see the hot emoji. Wow, South Africa. Nice, nice, nice. Amazing, amazing. Please let's keep doing that as we welcome our colleagues who are still in the waiting room to join us. Thank you so much. And I'm really interested in seeing our emoji because I believe this little exercise is actually the whole session in a miniature actually, because your emoji is like a data, right? To tell us how your weather is like a signal, okay? And if we are able to get like 50, 100 of that emoji and feed it into a system that can act on it, I think that's going to give us some data, I believe, right, to give us an outlook of how the weather is across different participants' location. So I think that's a bit of what we're going to speak about on the panel session that is upcoming during this event. Thank you all. Thank you all. I can see that we're all putting in our introduction. Great, great, great. Amazing. So without wasting much time, it's exactly 4 p.m. West African time, and we are going to go right into the webinar. Awesome. Once again, welcome to the Africa Climate Change and Health Week 2026 webinar. Today, we'll be looking at health on the front line, where digital meets the climate crisis. And this is being organized, as I've said, by Digital Health Africa. And I'm going to quickly share a bit of backstory about the Climate Change and Health Week, and also tell us why we are all here today. Because climate change used to get talked about as an environmental story, but in Africa, for us, it's an urgent public health affair, right? Because we see rising temperatures that are pushing malaria into new regions, flood, water, all of these things are driving public health concerns and disease outbreaks. So for us, it's an important conversation to have, really, and that's the whole premise behind the Africa Climate Change and Health Week, which we launched at Digital Health Africa in 2024 as some sort of an advocacy initiative. And this webinar is where we really unpack how we can leverage digital tools to actually strengthen the health response on ground. And that's what our speakers are here to unpack for us this evening. For us, this is our third year convening this. We've done 2 editions so far. We started in 2024 and then 2025, and now we're in 2026, still continuing the initiative. So a bit of housekeeping. This event will take around 90 minutes. We'd like everyone to mute their microphone. You can always rewatch this on our YouTube channel. It's being recorded, so if you want to drop off at any time, please don't worry. You can always catch up on the conversation. If you'd like to contribute to the conversation, you can please use the emoji to raise your hands. And if you have questions or reflections or comments, please drop that in the chat and we'll do it to read it out to the audience. All right, great. Moving on, I'll just briefly talk on Digital Health Africa in case you are hearing about us for the first time. We're a Pan-African organization dedicated to strengthening digital health capacity, advocacy like what we are currently doing with the climate and health discussion, and innovation across the continent. We provide media services, capacity building training programs, research and data insight across Africa on digital health and how we can continue to push the digital health agenda on the continent. So if you like to partner with us, these are the different thematic areas in which we are hoping for partnership. Thank you. And then, as I mentioned, we've been doing this for the past 3 years. That is the Climate Health Week. And this is our third year convening this conversation. So when we kicked off in 2024, we did a continent-wide advocacy week just to build the initiative from the ground up. We had partner organizations, volunteers across 9 plus African countries, and we were able to reach over 10,000 people through our community and digital channels. As you could see on the screen, we got support from different organizations across Kenya, South Africa, Liberia, and each of these organizations actually did specific activities in their own community, to celebrate the Africa Climate Change Health Week. You could see that we reached 5,000 people through a community sensitization and sanitation initiative in Kenya, done by one of our partners. Then we have Aaron, who is also a returning partner for this week, who led a 200 youth climate health training in Kisumu County in Kenya. Then in Liberia, the ELTech Liberia also engaged about 120 people in community sensitization and sanitation. We had online webinars as well to continue the conversation, reaching over 200 attendees across 6 countries. And of course, we did a lot of social media advocacy, reaching over 5,000 people across all our social media platform. On the screen, you could see some of the pictures from our 2024 activities. You could see some of our partners that went to a secondary school in Kenya to really sensitize them about, climate change and how it's contributing to health challenges on the continent and what they can do to take action as young people. Different organizations even hosted their own webinar outside of DHA. They self-organized themselves around the week. You could see CC Hub hosted an event, as well as the Africa Albinism Network also hosted events. Several partners were able to do that in 2024 to celebrate the week. Now, moving forward, last year, we built on the advocacy we started in 2024 to then turn it to spotlight innovative solutions, that are already bridging the climate health divide across the continent. So we called for application, received over 500 applications across the continent, and we're able to select this top African youth who are building climate health innovation tools to solve climate health related challenges. Now to 2026, what are we doing or what have we done? Now we kicked off the week this Monday, and it's been a week of online advocacy, really. So we brought the two threads together, both advocacy, innovation, evidence, and action, under the UNFCCC's Action for Climate Empowerment framework that span across education, training, public awareness, participation, and all of that. So everything you see this week and everything you hear in the next 60 minutes is mapped to that framework, deliberately contributing to global conversation. So that's really what we've done so far and how the week has been for us. If you've been following us online, you've been seeing some of this content on our social media platform. Okay, now to today's webinar, we are here to discuss how digital tools can strengthen health responses to climate risk and all of that. And I also take this moment to appreciate all the partners who have supported us for this year's edition, for African Research and Impact Network, to amplify health and development in Africa, and also GIZ. Thank you so much for your support. And we will be hearing from some of the personnel from these organizations. Great. Now moving straight into the conversation. This is the agenda. And then we'll be hearing from leading voices at the intersection of digital health, climate, and communities. As you can see on the screen, we have diverse experience in our panel today. And to kick us off on the conversation, I'll be introducing our first speaker, Alois Urassa, who is a public health scientist and multisectoral development expert from Tanzania. He's a co-founder and interim executive director of AHDA. He's into research, leadership, and advocacy, and he is focused on building healthier, more developed and resilient communities amid climate change and changing geopolitical and global economic outlook. So Alois is going to set us on fire, not literally. I hope so, but it's going to set the terrain for everything that follows today. Hi, Alois, can you hear me? Over to you.
Thank you. Thank you very much, Asia, for the wonderful introduction, and congratulations to DHA for the good work, and partners, of course, for the great week. And this is really an important discussion to have right now, where we are really discussing an issue that is critical, that is timely, that is very uncertain, that we might not overcome it very soon, as it is something that, although it is within our hands in terms of causing the disasters, in terms of causing the contributing to the climate emergencies, then still it is nearly out of our hands when it couples with the natural causes to really try to defend it. And that's why we come up with different interventions, including adapting the situation, learning how to survive within the situation when it comes to the climate crisis. So as introduced, my name is Alois Urassa, and I'll be responding to or setting a scene for our discussion today. And I'll be looking at the Africa disease surveillance architecture, the climate emergencies, and then the climate ready surveillance. And looking at the reality and the team that is within DHA and partners, we are definitely composed of mostly young people who are ambitious, who will definitely be the ones to be accountable of the Agenda 2063. That is when we are celebrating 100 years of the formation of the African Union, when we need to account for the next generation to tell them what have we been doing in all those years since we have been saying we are championing for the Africa we want. Are we going to really have the Africa we want if we are not going to utilize the potential, the opportunities that we have right now to respond to the crises that are likely to affect the future of Africa, the future of our communities? And when we look at our disease surveillance architecture in Africa, as young people, as people who are who gives ourselves a lot of titles, innovators, uh, many different titles, AI experts, digital experts, and everything. Are we happy with the way the architecture looks like? Which is, I would describe it as a very disintegrated, or more of even where there is integration, it is highly fragmented and at risk of breaking at any time. If we look at these problems, we are discussing health and we are discussing climate still in siloed. Thanks to initiatives like this that brings together these issues of climate and health, which are major threats that we have together into discussion. But back to discussing at the architecture of the disease surveillance systems. If we look at the architecture of the disease surveillance system in Africa, we look at one as the major system. When we are discussing the international systems like the district health information system that is widely used in more than 40 countries in Africa in managing the health information system at country level. And then you look at the IDSR, the integrated disease surveillance system, and then you look at EBS, the event-based system, which is, those are some of the common systems that are highly used in multiple countries. But then when you look at just even within the health sector itself, you'll realize that the system itself within the same sector is already not integrated. And then when you look at the other side of the hand of the coin, is you look at the climate systems. When you look at the systems like EWARS for the early warning systems for that are there to tell us about the anticipated climate threats, climate emergencies. Like recently, I'm sure most of you have had the news of the threat of El Nino that is to come soon. But then where is the integration and the prediction of what this looks like in when it comes to the public health systems? How are these systems speaking together? How accurate is the data that is training these systems or the models that are present to inform the system? Because oftentimes we hear our meteorological agencies warning us of things and then they never happen. Or sometimes we don't hear them warning us and then things happen abruptly. So what is our role as young people? And I think this is really core to our discussion today, to look at what actually can we bring on table. And beyond talking about digital systems, how do we ensure that the community voices are really embedded into the systems that you are building? I was looking I was reading through one of the research done by Silent Advisors, which mentioned that Africa has more than 1,260 digital health startups. Just at the level of startups, more than 1,260. What actually are these startups contributing to the digital health architecture of the continent? Who is monitoring? How do they speak to each other? What problems are they solving? Are they really problems? And we can go beyond and look into other countries, learn from countries like China, for instance. How do they manage to build very robust, very strong systems that really respond to their emergencies, that really respond to their issues, that really respond and fix quickly when issues emerges? And to say whether the systems are ready or not ready, we really now need to think of thinking at the ground level, thinking at the ground issues. Do people know, if you talk to someone who doesn't have internet connection in your community, do they even know, or are they even informed of what systems are in place, or do they have access to information or timely information to any emergencies that might happen? Or if you're building a system, if you're talking of AI, if you're talking of virtual realities, are they relevant? Oftentimes I do say, if something doesn't work for my grandmother, it's definitely not going to solve a problem that is existing in my village. So always we need to ask ourselves, all those datas that we are writing, all the programs that we are writing, the digital innovations, do they really work for our communities? I'll give an example from what we are doing at AHDA. Is what we are trying to bring the voices of the communities through community dialogues to discuss, to ask for their views, their voices, in terms of, if you're developing a scorecard, how should it look like? If you're building a digital response system, how should it look like? What are the best ways you think you can utilize this platform? If we put these features and these features, if we put this this certain type of interface, the young person who is in the village, a a motorbike rider, do they feel like this is a system that they can safely access, and many other things that we need to consider. But just to conclude is that maybe we need also to look at the whole approach of does all these technologies, all these digital solutions that we are discussing, are they going to translate into the development of and for the people? Looking at the core issues of development, are they going to lead to life sustenance to the people that we are targeting? Are they going to increase the self-esteem of the people? Are they going to increase the freedom of choice, freedom from servitude? And even when we are developing those technologies ourselves, are we free to choose that I want to use this kind of data set, and is that data set accessible? Are we free to say, I'm going to build this high level, or I want to use a certain data center that is really readily available in an African context? So as we discuss and remark into this important day of the Africa Climate and Health Week, I think it's really robust that we keep beyond this conversation today, we take out something that is really important, that whatever we are doing, whatever innovations, whatever awards that we are winning out there by pitching a lot of different things, do they really translate to the real development of Africa? Are they really helping our communities? Are they sustainable? Are they going to build the Africa we want for the future? Thank you very much, and I'd like to handle this back to the moderator, and looking forward to learn from the next speakers from different areas, from AI, digital disease surveillance, telemedicine, and many other topics that our speakers are going to bring. Thank you, and over to you.
Thank you. Thank you so much, Alois, for that. Indeed, that's a fire starter. I think we are all you've helped us to think about the changing nature of climate health related innovation, and why we need to be people-centered, community-oriented as we look at building digital tools to solve for climate and health. Beyond the technology, beyond the innovation, does it translate to the development of Africa holistically? So thank you so much for that insight, and for starting us up on that note. I would like to call on the next fire starter, Martins, whose work sits at the intersection of climate, digital health, and health systems. So please, if you have questions for Alois, please do well to drop it in the chat. We'll read it out as we go along with the conversation. Hi, Martins, can you hear me?
Hi, Vivian. I can hear you. Thank you very much.
All right, thank you. Over to you.
Can everyone hear me, please? Can we get
Yes.
reactions in the chat? Yeah, thank you very much. Okay, it's good to be here. My name is Martins Iyekekbolo. Do not try to pronounce my surname. You might not survive it. I'm Nigerian, and it's exciting to see all the work that has been happening in Africa around African Climate Health Change Week. I've been doing this work around the research, human-centered design for the last 9 years. And I think in that time, I think I realized what's most important is that we do not just share what we are learning, but we also challenge others to continue the gaps in the research that we cannot run ourselves. So I'll be sharing my thoughts, very raw thoughts around mapping Africa's health data infrastructure. It's so complex. All right. I have like a couple of slides that I want to share, just like 2 slides really. Can I share my screen? And Vivian, let me see. Okay. Can everyone see my screen?
Yes.
Can everyone see my screen?
Yes. Yeah, you can see it.
Okay. All right. Thank you very much. Measuring the heat, mapping the health data infrastructure. So in the last 4 years, we've been running a programs called the High Horizons, right? It's heat indicators in global health. That's what the project is about. So what we've been looking at so far is that there are several hazards when it comes to heat, and there are different aspects of climate change, right? You could look at the environmental aspects. You could look at things that had to do with extreme weather events. You can look at several other factors, the agricultural related aspects of climate change as well. But we decided that we were going to focus on the extreme heat. That was about 4 years ago, and 4 years, yeah, 4 years ago now. And since that time, we have realized that not only has there been increased intensity, duration, and frequency of heat stress, but there's also been a rise in the average temperature. And because of the kind of expertise we have in our consortium, we estimated that based on the data that we have, there's been a 1.5 degree rise in temperature over the last 25 years. And we then modeled 3 different scenarios. We modeled a scenario such that if we projected what will happen in the next 20 years in terms of every 1.5 degree rise in temperature, what's going to happen to under 5 children when it comes to diarrhea diseases in Kenya, South Africa, and Brazil, right? We modeled those scenarios, and all of that result is available online. I'll share a link to that soon. But in our modeling, one of the key things we could see was that not only was heat affecting maternal health, heat was also affecting perinatal and fetal health, and heat was also affecting newborn health, right? And if we talk about data infrastructure, it's important that we know exactly what we want to measure before we start to measure, right? We know what subject we want to think about and in that regard. And so when it comes to like the health of women, there is gestational hypertension that is triggered or exacerbated based on their exposure to increased heat stress and heat waves. And there is preeclampsia, there is stillbirth, there is congenital disorders. Now, all of this can be chalked down to maternal, newborn, and child health in a health facility, but we believe that this is not the time to start chalking down things and directly attributing them to, let's say, the woman bled excessively, she suffered from postpartum hemorrhage, and she lost a baby, etc. We should look at the scenarios and the context around that event before we can name it what it is. And that gave us a specific problem. It was not just a data problem, it was an attribution problem. How could we tell what was the actual cause of the gestational hypertension? How could we tell what was the actual cause of preeclampsia? How can we tell if the stillbirth that resulted is as a due to rise in temperature? How can we tell that actually? We realized that not only was there a poor problem in measuring, right? There was also a big challenge when it comes to indicators, right? And in between the indicators that are used in our data infrastructure, we also had a problem of poor communication. And if you go online, I think in the last precisely 3 weeks, you see a lot of information about heat waves from several organizations I'm talking about the extreme weather events that's been happening, the high increase in temperature. So when you see online climate content, it's basically spelling doom, right? So that's not my result. That's from Smith. Smith said that is in his review, he found that 30% of online climate content is just saying health. 60% is fear-based, right? We are talking about how the world is going to end, how we're going to self-destruct, right? No one is really thinking of, okay, what are we exactly doing to contribute or to tell that story in a way that is focused around the solutions that we should be building. And so when I come back to measurement just a little bit, you realize that in a recent review that was conducted last year, there are several countries who do not even have a heat health action plan. Sorry, can somebody mute Damilola? I think there's noise from my end. Right? There are several countries that do not even have a heat action plan, and those who have a heat action plan, they don't even focus or bring out the pregnant women, the newborns, from that. Right? So the data infrastructure is missing out, number one, on the population. Number two is missing out on the indicators. What exactly are we measuring? Right? Alois mentioned a number of data tools earlier. He mentioned DHIS, he mentioned EBS, he mentioned several other data platforms that is being used, and he talked about fragmentation and how we pose ourselves in Africa to be innovators and experts, right? Yes, so you can see all of this. So not only are there some of this infrastructure, there is poor measurement. And I think lastly, just because we have to follow up on research. So in partnership with the World Health Organization, we came up with a list of what we thought could be indicators that could be used to trace how does extreme heat, right, directly and indirectly affect mothers, newborn, and children. All right. And in the last couple of months, let's say precisely in the last 12 months, we've been refining this list of indicators. We've been trying to understand how do we get these indicators to be things that countries can think about and start thinking of a data infrastructure that will work for them within their context. So what is an indicator? I put on the screen that it's basically a standardized metric that can be tracked over time just so that you can take action, right? But if we now go down into the niche, by heat MNCH indicator, we mean a metric that's specific for how does heat affect pregnant women, newborns, and children. So we think that for our infrastructure to be robust when it comes to data, right, we do need to think about very narrowed heat MNCH indicator, right? So we need to be able to tell how exactly is heat affecting newborns, how exactly is heat affecting women, how exactly is it affecting children, etc. We need to find those pathways, and we need to be able to attribute to all of this. So in my work so far, this has been the extent of what we've been looking at, right? While we've gone ahead to look at indicators that could work across several levels, like heat-related illnesses, heat-related strokes, heat-related diseases, or disruption to productivity and other things, right? What you can see on the screen towards the right, and some of those things highlighted in green, right, are some of the things that we can trace to be indicators. Is poorly built. I'll drop a link for you guys to take a look at the conceptual framework properly maybe later on. Let me close with this. In our health data infrastructure in Africa, we do not just have fragmentation, we have a blind spot, right? And the blind spot is because heat-related illness is very difficult to diagnose, and we currently are not documenting it. We are not able to recognize heat as a gap or a health issue. We just think it's a weather issue or it's an extreme weather event, whatever. It's for the Ministry of Health or Ministry of Environment. And in these places, we are not able to strengthen our systems by thinking about something that could bring together both the workforce and make the necessary investment that is required for recognizing, recording, and acting on heat as a threat to not just the mothers, but also to the babies and to the healthcare workers, to also those who are measuring it. I'm going to stop sharing my slide for a bit, right? So far, so good. What I'm saying is we are not thinking about new tools, right? We need to think about in our health data infrastructure, how hot is the room, right? How does the room get hot, right? We need to think about, oh, do we have a data gap? Not really. We need to think about what are we doing with our currently available routine data? How do we make that more refined, right? So that we can know not just where the health facilities are, right? But so that we can tell what exactly is happening across the health facilities, right? Because part of our project, we do have something that alerts pregnant women about the weather that's going to come in the next 10 to 5 days and tell them what kind of clothing they should put on, what kind of things they should do to protect themselves over the next couple of days, tailored to their context in their local languages, right? So a 10-day weather forecast across any facility that can tell you, all right, let's get the right coordinates. We need to start investing in like the inventories of like the national system, right? To not just say, oh, we don't know where the clinics are. We know where some of the clinics are, but it's not just geo-pointed. We need to get health systems to refine their structure and get researchers who can triangulate what is happening in their regions and pin it down to a facility. I hope you stay for the rest of this session. We have a whole lot of insights to share with you. Thank you so much for listening.
Wow, amazing. Thank you so much, Martin, for that. I think you've really pointed out some key things we need to pay attention to. The fact that heat is not simply a weather issue, as you mentioned, and we most importantly we need to understand not just whether heat affects health, but how, where, who is most vulnerable, what health systems can do about it, and all of that. And thank you so much for sharing the work you're doing around developing the indicators that can connect, heat exposure directly to maternal, newborn, and child health, giving the health system something they can actually measure and act on. So now we've had two important pieces of the puzzle. Alois helped us to think about whether our surveillance systems are ready for a changing climate, how we should think holistically about, when we are developing digital tools. And now Martins has shown us why the underlying data infrastructure actually matters. So the next question is now, how do we bring these pieces together in practice? And that takes us to our knowledge presentation. We now move from the challenge, the data landscape, to a regional evidence, a program experience, and practical lessons from the intersection of digital health and climate adaptation across Africa. And with that, I'm pleased to hand over to Setonji from GIZ, who is going to walk us through some practical lessons of what the organization has done and how they were able to turn climate and health data into systems that can support real-world action. Setonji, over to you.
Thank you very much. I'm trying to share my screen. I hope you all can see my screen.
Yes.
Super. So really, thanks to the guys who just presented. I think they already gave me like a very good landing for me to also share aspects from our implementation on the continent. I am Setonji Ogunbiyi. I'm an advisor in the One Health Data Alliance Africa project, and I work for the German International Development Organization, GIZ. So I start with the issue of One Health. So Martins as well as Lois have already mentioned things that already talks about One Health. So when we talk about One Health, we are talking about the harmonization of human health, animal health, and the environment health. And most often than not, when we talk about One Health, we usually just talk about the human health as well as the animal health, because of course we are humans. Whatever happens, we are the first in the line of the casualty, and then we talk about the animals. But most often than not, we usually forget the environment, and it is environment that is one of the most important aspects that we think of when we talk about One Health. And today I try to show you also why this environment is important and why some of these environmental issues are very, like they are key indicators, like Martins has mentioned, of our own health as humans. So our project started in 2022 and is expected to last until 2028. We work with the African Union, Africa CDC, the African Bureau for Animal Resources, as well as individual countries, Cameroon, Malawi, and Togo. And the challenge is the same, like our colleagues already said. We have systems that do not talk to one another. We have data that do not speak with one another. We have institutions, we have ministries that do not collaborate with one another. The standards of information we collect, they do not speak to one another, and we cannot use them to create insight. And this is where our project tries to solve part of these issues. We want to make sure that the systems are talking to one another. We want to make sure everyone has joint standards, and we want to have rules that guide all this approach. And this is the main approach that we try to do. So we start usually by creating joint standards for all this data that we have and the systems that we have. And then we think of how do we connect the systems together? So what kind of interoperability or digital layers do we implement so that different system that is being used by the Ministry of Health, for instance, can communicate and understand the system being used by the Ministry of Environment or the Ministry of Agriculture. And we do this by employing or deploying digital systems that are open source and are available for everyone to use. And the aim is to facilitate partnership across human, animal, and environment health, as well as to work on the Schnittstelle, or like the intersections of climate adaptation and health. So what have we done with our partners in the African Union? We started by supporting the African Union to develop a One Health information policy and architecture. So this is just like a blueprint that mentions all the kind of data that are existing on the continent, the human health data, the animal health data, and the environmental health data. And then just to think about the standards that we need to have for this data and the systems that are accompanying this data to be able to communicate with one another. And using this set of rules or framework, the African Union, through support of the German government, were able to develop the African Union Digital One Health Platform. And this platform is like the direct implementation of the standards and the frameworks that has already been developed by the African Union. And in this platform, different kind of models to be able to bring this data together. What models are you going to use to analyze data coming from animal health or human health and environment together? What are the indicators that needs to come out of it, and how do you measure this? These are then done together with the partners so that you can apply them to incidences of diseases such as rabies, malaria, mpox, and so on. And this whole thing are being done by people. So the machines do not run itself. It's being run by people who come together to contribute to the data, to contribute to the standards, to contribute to knowledge. And I have to be proud to say that our project received like ITU World Summit on the Information Society Prize in 2025 for being able to bring all these different stakeholders, different actors, data and information systems together to be able to make sense of the data that we have. We were able to get this prize, and through the community that we have and we manage for the open source community, we also further like advocate for improvement of the platform so that it's also being used by the member states and improved upon. So for me to be able to explain what our main implementation aspects are, I'm going to give two scenarios or two cases. The first case is the malaria vector spaces that we did with IGAD. So IGAD is the Intergovernmental Authority on Development. It's a compromisation of the Horn of Africa member states who come together under this development or economic community. In IGAD, the climate is such that the climate or indicators are very extreme in the IGAD region. And the result of this is that you have some very high temperature, you have droughts, you have proliferation also of vectors. And we thought of how could we use like this climate data to be able to monitor the spread of malaria in the IGAD region. So it is important to note that the whole of Africa is being plagued by mosquito and malaria. In fact, just Nigeria alone, for instance, already accounts for like a quarter of all the whole malaria cases that we have, and the countries in the IGAD region also account for about 20%. So for the IGAD region, it was a priority that they have some form of ways of predicting where or when malaria infections are expected. So what we did is to use some new approaches that we had. It's called the temporal graph convolution networks model. It's a new exploratory model in which you use satellite images to divide the maps of countries and places into very fine rasters that is called voxels. So these little tiny boxes are like very good resolution of what is happening in individual places. So for instance, if you live in Nairobi, on this map, you can divide Nairobi into like 200,000 boxes, and you see the relationship between each of these boxes to predict how the influence of weather or climate can affect another area within another box. So mapping this kind of relationships gives you some form of indication of the movement of, for instance, malaria or climate indicators over time and over space. So you can have in a place high rainfall, but in another place that is downstream, you are having like flooding, for instance. So we try to use this model to measure this kind of relationship that exists within this place to predict which places are more likely to have malaria. So you have different kind of risk that you use to map them, and then you can always map the risk in terms of probability and the likelihood of these events happening in some other places. And using this model, you can map the incidence of these mosquitoes and malaria, and then you can carry out some preventative measures. And to be able to do that, we worked really closely with the IGAD Climate Prediction and Application Center, ICPAC, where they already have like this data on this climate issues. For instance, here you can see the one for temperature. And when you zoom a little bit deeper into this, then you can see the relationship between this temperature over fine areas of land. And then you can see the movement. So when you move east, west, or north or south, you see if the temperature is increasing, if it is reducing. And if you go into another variable like rainfall, you also have this. And then when you overlay all this information and then map the relationship, then you can really see the information on how these events can be used to predict the cases and places where malaria can happen. The second case I have is from Cameroon, and it's the climate-informed malaria monitoring in Cameroon. So if you remember before, I mentioned that we developed like a platform with the African Union. Cameroon is one of the few countries who have implemented the system in their country as the platform they want to use for One Health. And in this system, we imputed or we harmonized epidemiological data as well as climate data into the system. And we use it to make like forecasting for disease based on information that they had from 2019 to 2024. And with this information, you can already make like some kind of predictions on a year-on-year basis to see the predicted and the real cases of malaria that you are expecting in the countries as well as based on the district. And based on this information, the government can make some policies or make some programs to which they can use to prevent malaria. What does all this mean for climate adaptation? So I mentioned modeling, I mentioned harmonization of data, I mentioned some other things. It helps us to be able to anticipate and plan for what is coming in the future. So if you have the data on what is happening, you can, to a very level of accuracy, plan what you are expecting in the future. And when all these things happen, still, you are able to manage the shocks that you are receiving in the country because you already know what to expect. When it happens itself, you already know the measures you need to take. You can respond much better, and then you can also recover and learn from everything that you've learned. So what are the lessons that we learned from our implementation, and how do we see the future? One of the most important lessons is to involve everyone right from the beginning. It is always good to start with technology, to start with other things, but it's very important that you bring everybody to the table and then they discuss what it is the problem is, and then together you can map out the approach that you want to use to solve this problem. The second one is to build on existing national and regional structure, platform, and institutions. So like the previous people said, many systems already exist in the countries, and many of these systems can talk with one another. They are always like application APIs that you can use to connect one system to another. So we should always think about interoperability, integration of data and information systems, rather than building new systems to replace the other one. You start from the problem, concretize approach, and then always use a use case. So if you have a case of a problem that you want to solve, it already solves like 50% of the problems you want to solve because you already have an approach, and then you can already attack this approach in this sense, and not just starting from down up, but then you choose something, you know the problem, and then you can attack this problem. Governance and standards are very important as the digital platform. So agree on the standards. I think this aligns with what the previous guys also said regarding indicators and standards, and we should strengthen local ownership and capacity because these are the people who do it. So what is the future outlook for us? We have this open source platform with the African Union. Our goal is to bring climate and health data together. So as I mentioned in the beginning, climate is usually the place where a lot of data are not integrated with health, but of course they affect human health and animal health more than any other thing. So this needs to be systematically included in the data that we are doing so that they can also give us more insights regarding what we are doing. More use cases and models for nowcasting and forecasting. With the new AI bubble that we have now, it's also very important that we are able to align all these aspects to them. We scale the use cases and models across African countries and beyond. Of course, we started in Cameroon and IGAD, but we also want to extend to other countries. And we are also using this approach as very good approach that we could scale even beyond the African continent. So disease outbreak does not only break out in Africa, it breaks out in other continents, North America, Europe, and Asia. And we want to be able to use the experience of what we have from data and the expertise from Africa to be able to show people outside the continent that these are the steps that they need to take when they are doing this. So I hope I've been able to give you some insights regarding how we use data and climate data, for instance, to be able to improve health in Africa. Please, if you are interested to follow up, you can always reach out to me. Thank you very much.
Thank you. Wow, that's such an insightful presentation. Thank you for really showing us the evidence and walking us through what GIZ and the ODHAA team have been doing. I think that's really an incredible work. Congratulations to the team. And I think you've just shown us what evidence-backed adaptation really looks like when you have all of these factors in place, the governance, the standards, when they come first. And of course, you've mentioned that in the lessons that you've learned from the implementation of this initiative. Thank you so much, Setonji. I think for me, that was very insightful. Now we'll move into the panel discussion. And I hope we have all our questions ready for our panelists. They've really talked, on different aspects from their different presentation. So I believe we should have questions for them around climate change, digital tools, and the One Health approach that Setonji just briefly shared in his presentation. All right. We have a speaker who have not spoken, so I'm going to start the panel discussion from him, and that's Dr. Francis Olo. I hope you can hear me. Okay, I can see Kamilu that your hands are up. Is that for a question? Kamilu, is that a
It's a
question?
question.
All right. Okay, go
Yeah.
ahead. Go ahead. Go ahead.
So, good afternoon, all. This is a very important presentations. My question is regarding intergovernance and interoperability. Looking at the Nigerian context, the Ministry of Environment and Health currently work in parallel. Also, even the INGOs that currently work in country have different data collection platform like DHIS, ComCare HQ. But the problem now is we don't have a central database that ensure various data speak to themselves. So I think the best way is to come up with a strategy whereby we have a common system whereby individual data platforms speak to others. For example, by linking the environmental data and health data to a specific database that can support both government and INGOs that is providing both humanitarian and development support across African countries. Thank you.
Thank you. Thank you very much. I'm not sure that's a question. It's more of like maybe a contribution, but I'll allow Martins or Setonji to just chime in on that. If they can share from their experience, if that has been a challenge for them and how they've been able to work around it, or what are the probable solutions, as Kamilu just mentioned.
I could say something about it. Yeah, I mean, it's totally correct. The fragmentation is much more deep than usually we even know. It's everywhere. I would not tell you that it's not everywhere. I work in Germany, and I can tell you the same problems we face in Africa. It's global. Fragmentation is everywhere. What we need to do now is to first advocate that we need to have the standards that bring everything together. I give an example of Rwanda. Rwanda is a country that has been doing this really, really well. The systems that they use in Rwanda, they have one that is called Ibuzima. They also have a DHIS2-based system, and these systems are well connected. So they have systems on the district level, they have systems on the community level, and then they have systems on like the national level. And each of these systems feed into one another. So on the national level, if you need information for public health insights, you can already get this aggregated information from all the information coming in from the community and the district level. And this is something that we need to emulate and things that we need to also advocate for in our communities. To be able to achieve this, we then need standards. We need information regarding what is this data going to be used for? How do we bring them together? How do we harmonize the definitions you have in your system with the definition I have in my system so that when other people read it, it makes a lot of sense to them? These are the conversations we need to have and to be able to do this. So in the terms of One Health, I would say this is going a little bit in the right direction. But of course, we also have in other areas that this has not been done. So we need more advocacy like your voice to be able to achieve this.
All right. Thank you so much. Advocacy is really important. Martin, do you have anything to contribute? Or Setonji have said it all?
I think for the interest of time, Setonji has said it all because it's actually very true what he has said. Yeah.
All right, great. So I'm going to quickly move to Dr. Francis now so that we can also hear from him. I know he has a lot to also share around digital tools and surveillance. So Dr. Francis, hi, I hope you can hear me.
Yes, I can. I can
Oh,
hear you.
amazing. Nice.
Yeah.
All right, thank you. So from your experience, we've been talking about digital transformation in Africa health systems and all of that. How much of this transformation is actually reaching the frontline facilities or workforce that are most exposed to this climate-driven health threat, as we've been, discussing? Thank you.
Okay. Yeah, so thank you. Maybe because I'm speaking for the first time, I could potentially just introduce myself a bit.
Yeah, please go ahead.
Yeah, so my name is Francis Olo. I'm based in Kenya at the African Research and Impact Network. My background is in geoinformatics, and in geoinformatics, I've done a number of things, including research in epidemiology and also developing tools that are used by frontline workers. And then at ARIN, we are also very much involved in climate and health work. And when I come to your question, I think the first thing I want to say is that the connection between climate and health is really the location. That when there are changes in climate, they happen at a particular location. So when you're talking about heat, we don't talk about heat generally, but the heat changes at a particular location. And we have this first law of geography, right? That nearer things are more related than distant things. So it means people at a particular location are going to be affected. And so when you also think about the frontline workers, I think digital transformation has contributed significantly to how the first responders are able to respond, because, and I'll want to highlight a few digital progresses that we've been able to make. One is in the sensor systems, the sensors that we have, the mobile telephony that we have, so that now a clinical officer in a very rural setup or in an informal settlement is able to access digital solutions and is able to use these for the sake of an intervention. So whether it is a matter of taking records of a patient or even getting information that can assist, this is one of the things that has really been able to help, because now you don't need computers everywhere. You just need a responder to have a mobile phone, and with that mobile phone, they can be able to collect data, and they can also be able to get help that they need. So that is what I want to say, and I think this is going on across Africa. Of course, we'll also speak about aspects of social justice and stuff, but the fact that now technology is becoming commonplace, is becoming ubiquitous, that has really helped. And maybe just to conclude also, another technology, when we talk about the web, for example, we are at a place where the web is not just a place where we read information, but is a place where we read and write information. So one of the ways is, if there's a patient and they have a particular symptom, you can tell them, can you take a photo of it? Can you speak about it, so that based on how you speak about it, I'll be able to get more information about it. So I think that is what I can be able to highlight up to this particular moment. Thank you.
Thank you so much. I'm still not done with you. I have a follow-up question on what you just mentioned. You mentioned that, of course, when we talk about climate, we're looking at location, right? So, I believe that a lot of the climate health evidence still comes from wealthier, less vulnerable countries that have strong data infrastructure. So, in your experience as someone who have experience with GIS and all of these things, how can geoinformatics help close that evidence gap for lower resource or data scarce regions in Africa?
Okay. Yeah, and I think that's why I said the intersection between climate and health is really the location. So geoinformatics, I'll want to give practical examples. One, although lots of technology comes from the global north, if I could call it that, some of the data that is collected across the globe. So for example, if you're thinking about climate data, and initially, one of the challenges that we had was that our governments in Africa were not able to collect data so consistently and at high resolution Now, with this satellite technology that you have, it is possible, for example, to estimate changes in temperature, land surface temperature. If I wanted it at 30-meter resolution across Africa, or I'm able to get that. So that is one of the situations. The other also is the fact that even in Africa, we are growing to a point where we can create our own data. We are using the globally developed infrastructure to create our own data. So for example, one of the things was in terms of understanding accessibility. We were not able to understand accessibility initially because we didn't even know where our road networks were, where our facilities were. But now with infrastructures like OpenStreetMap as an example, or even Google Maps, on OpenStreetMaps, we are able to create our own data. And I know approaches or projects like Hot OSM have really contributed to this, where when there is a particular climate situation, let's say flooding or something related, some shock, then they're able to send teams, and the teams are able to generate data, and this data then becomes perpetual. And also, I think also in terms of geoinformatics, not just in terms of the data collection, but we now also have the skills to carry out analysis that can then be able to map Africa as it should really be mapped. So I think those are the few things that I can say to that question.
Thank you so much for that contribution. And your last point around skills will take me directly to Alois. Alois, are you still with us? If you can still hear me.
Yes, I can hear you.
Yeah. So you work closely with young health workers, digital innovators, and community actors, and just building up on what Dr. Francis mentioned in his last points around the skills. So what do we need to do to give this frontline actors, the skills, the capacity building that they don't have today if we are really serious about building climate-ready surveillance or how will I call it? Climate ready or resilient health systems, that are resilient to climate changes when we want to leverage technology. What do you think we need to give to the community healthcare workers, young innovators, or community actors, to ensure that they are ready to use some of these tools?
Thank you very much, Asia. That's really an important thing to think about and look at, as it's the core to achieving all the discussions and where to ensure that the digital meets the crisis that is facing the community, especially through the frontline workers who are always at the center of responding to issues, and not even just responding, but just even realizing that this is something that has a long-term impact, or something that has an immediate impact to the community, which might really be disastrous. As I was doing the opening, I said about thinking at the ground, looking at the realities. When you think of the ground, the frontline workers, the young people who are in the communities that are more vulnerable to climate crisis, that are more vulnerable to health threats that are becoming more jeopardized with the climate crisis, then we need to think of the major things like, are they connected to internet? I know, yes, there's in the statistics we see that the internet connectivity, or the enrollment to social media, for instance, by young people is steeply growing in Africa. But then, is the reality the same when we take the data? If we disaggregate the data and look at the lower level communities, is it the same case that there's a steep growth in terms of internet connectivity at the lower level? I know, for instance, in Tanzania currently, we have DIRA, or the Vision 2050, that looks at ensuring that there's rural connectivity, not only for internet, but because even if you take a network, a certain internet provider to a rural area, if electricity is not stable, then there's no way that these people are going to be stably using this internet to access the digital tools and the digital platforms or any other surveillance system or emergency response system that they have to interact with. So before even building the skills for the young people, we need to ensure the infrastructure that is needed is present in the community. The connectivity infrastructure, even the road infrastructure itself, internet infrastructure, the physical and the software is present in the communities and is ready to reach them where they are. But also it's built at a quality that is competent enough for the world that is really changing rapidly. And two is to look at the mindset of evolution for the young people to understand and see issues more widely. I know currently some studies in the education sector are already showing how the use of artificial intelligence, for instance, in learning is affecting the young professionals in Africa. But even this week, I was just talking to some colleagues of my young brother who is doing computer science and IT, information technology. And then we are trying to discuss on the quality of the education that they're getting from the school, the theory and the practices that they're being taught. And you'll see there's still a huge gap still a huge mismatch between what is being taught in school versus what is actually happening in the world. The realities of the fourth industrial revolution are not yet well embedded into our curriculum, into the education curriculum, the formal education system. So someone has to graduate and then start looking for informal short-term courses, to look for online courses in order to sharpen skills that they were supposed to have gained them in school. So I think there is also a need to advocate strongly to ensure that our curriculums are not fixed, are not static, and are not adamant to the traditional systems, but they adapt to the realities of the changing world. That's how I think we can really build a generation that is well equipped, that is well skilled, and ready to respond to the situation. Now, maybe my brothers who have studied abroad and both have a mix of studying here in Tanzania and here in Africa, I'm sorry, and from other countries or working from other countries might also have more experiences to share. But from my experience and the conversations and what I see from the young generation is that there's still that mismatch existing between what we learn and what opportunities exist and what problems exist to be solved by us. But then, despite all those challenges, we need to wake up more, utilize platforms like this, build stronger networks, learning networks for young digital health experts, stronger networks to before even going or thinking of projects, writing up projects, before thinking of implementing certain grants, applying for certain grants. Then we need to think of how do we sharpen our minds, how do we sharpen our abilities to look at problems holistically, how do we sharpen our critical thinking skills through and stepwise ways of solving the issues that are facing us and chasing or racing with the advancements in science and technology. I think I've taken longer than I was supposed to take in responding to this. Back to you, yeah.
Yeah, totally agree with you. Thank you so much, Alois, for that insight. We need to change our mindset around capacity building. We need to advocate for our curriculum to be updated and to meet up with the demands of this current age that we are in, for our young people to be able to effectively contribute and engage with digital tools to support our healthcare system. So as we wrap up this panel session, I would move quickly to Setonji to quickly look at, the work you've done, that you presented previously. Of course, I know there were a bit of AI, or there were a lot of AI and predictive models that you mentioned. And I believe that these tools are being used to understand climate-related health risk. So what should innovators, what should people consider when they're developing AI solutions for African health systems, particularly in cases where our data, our infrastructure, and even the technical capacity, as Alois mentioned, it varies significantly between settings?
Yeah, thank you. So the main thing is, what problem do you want to solve with this? Um, you have to identify a problem that is really happening in this society, in the community, in the country, in the state, in the city, before you can also even just build anything. Because if you just build anything, at the end of the day, you might not even be able to use it because it doesn't address any problem. So the first approach is to first know what is the problem and who are the people that this problem is really affecting in the society. And then from there, you can then go further to talk with these people. How would success be with you? So if you have a community that they are suffering from malaria every time, you would not build a solution that addresses, for instance, tuberculosis. It's not going to succeed. So you go and then you talk to them regarding how would success be for you. Is it when you are able to get rid of malaria itself in your blood, or if is it if you are even able to get rid of mosquitoes entirely, or is it when you are unable to have like this kind of pond, like this swamps and so on, that helps mosquitoes to be able to build? Then you can already build on this kind of information that you have with the available data. Sometimes we say there are no data, there are no data. I can assure you the data we have already in Africa is a lot. They are just kept somewhere in Excel sheets, in file cabinets, and so on, are not being used. A lot of this information that we keep are still information that we can use. They are retrospective. They are information of 5 years, 10 years, or even as early as a year ago. When this information are brought and digitized, then you can already make some inferences from the data that you have. So it's very important. Identify the problem. Talk with the people who this problem are really affecting, and then come up with an idea. So I mentioned before this use case approach. So when I want to solve this problem, what use case would I use to approach this problem? So the problem can be a disease. Then you can categorizes as malaria, rabies, and so on. But the problem can also just be that you want to prevent the breeding of malaria. So this is then your use case, and then you can then approach this use case in a systematic manner. I think Martin's already showed us the steps you need to take for you to have like a proper research approach to identifying and then to resolving all this use case. So start with that, converse with people, and then you can start to work with the data that you have to solve these problems. I think the final thing, we have a lot of resources already now, especially with the proliferation of AI that we can use. So life has become a little bit easier, maybe a little bit also more difficult, but I think the uses are much more than the negative effect. I mean, for now, I would say. Thanks.
Mhm. All right. Thank you so much for that insight. I have two more questions for you. I want you to take them together actually, and then we'd go to Martin and wrap up for the panel session. So for the project from the OHDAA project, it spans across Malawi, Togo, Cameroon, alongside the Africa CDC and AUIBA. Okay, so I was wondering, like, what's actually stopping this model from reaching Nigeria or maybe DRC countries that actually carry this heaviest burden of malaria? And my last question to you would be: you framed the climate adaptation in 5 stages, anticipate, prepare, absorb, and all of that. If you be honest about where we are currently in Africa, especially our current Africa health system, where in the spectrum do we currently sit? Are we still at the anticipate or prepare or absorb shocks or respond, or like are we still further back in the spectrum, or what's your take on where we are currently when it comes to how our health system is relating to One Health and climate? Sorry, you're on mute.
Sorry, I forgot. Of course, it's a project. It's limited in some areas, but the idea is that we have some champion projects we try to target different regions in the African continent that we can start with this kind of models, and then we can scale it most usually through the regional economic communities. So in the southern area, we have Malawi. Even in Kenya, we have this AU-IBA. They are based in Kenya. We have the Africa CDC. We have Togo, and then we also have Cameroon. So like we try to have them in different areas so that we at least cover some geographical regions that we have in the continent. And when we are able to develop this kind of models, then we can scale them quite easily through the regional economic communities that we already have, that is countries fall around. So this is the approach, because it's not easy to just capture all the countries at once. The other question that you mentioned is, I think it's still a little bit chaotic. I know to some extent we can predict when we are going to have malaria. When we know when the rainy seasons are coming, then we are going to have more malaria cases. We're going to have more mosquitoes. So I would still say we are a little bit in this stage, but we do have some data and some information to prevent this cases of malaria. I would say it's not yet systematic. It's still a little bit yeah, chaotic, I would say, but we do have some information and some processes in which people get anti-malarial drugs produced more. You notice also during this period, we have more anti-malaria drugs being produced. We have mosquito nets being shared in communities and places and so on. So we still have this kind of measures that we use to prevent malaria, but it's not systematic. It's not data-based. It's just we think the rains are going to start. We need to protect the people, and we just need to reduce the number of cases that we have for malaria. And this is still really evident in the results. The deaths of people based on malaria infection is extremely high on the continent, extremely high in Nigeria, and the number of cases of people getting malaria is also really high. So until we are able to go beyond that, just data that we have to be able to make real predictions. It's also varying in different areas of the country. If you take Nigeria, for instance, the spread of malaria varies also by geography. Francis already mentioned it and said, like, when you move from one place to another, the indicators and everything's change. So this also changes. So it means we have to focus more on some geographical areas that we have on the continent in countries, and then we focus less on other places because they are not much affected and so on. So this would be, yeah, I think, thanks.
Absolutely. Thank you so much for that insight. Great. I hope we're enjoying the conversation so far. And let me check if we have questions now in the chat so that we can take them and we can wrap up. Okay. How do we ensure interoperability? I think we've answered that particular question. For public health professionals who want to transition into digital health, what technical analytical skills should we consider? Okay. Where do you see the biggest evidence gap in climate and health research in Africa, and how should researchers prioritize future studies? Martin, I think I'll hand this over to you. Martin, if you'd like to take the question on where do we see the biggest evidence gap in climate and health research in Africa, and how should researchers prioritize future studies?
All right, thank you very much. I mean, it's been like interesting listening to Setunji and Francis so far. So I'll just answer this question about where is the biggest evidence gap. So because climate and health research is now just being recently run together, right? There is still a whole lot more. People are just beginning to catch up, to be honest, right? So we're having a whole lot of gap around the costing data right now. So not much has been done in that sphere, right? Like the costing data for what does it cost a woman to attend ANC or a facility? What does it cost a health facility to reduce carbon emissions? What does it cost the government to reduce carbon emission for their country in a year? So countries are also beginning to develop national adaptation plans, right? A lot of countries are catching up to like work on that. Kenya is doing quite well, and Rwanda is doing quite well, and some other countries actually. But then we also see that within the development of national adaptation plans, we don't have a lot of modeling research that goes into like shared socioeconomic pathways. For instance, if we do SSP 245, which is like shared socioeconomic pathways for what is it going to be in the next 20 years if we track down the impact, right, of extreme weather events on maternal health utilization. That is, if there are increased floods, increased rainfalls, will that affect the use of facilities? We don't have that intersecting research right now, right? And then we also do have, I can go on and list several gaps, right? We also do have a current research that has just been commissioned, I think, by Wellcome Trust, because there is now two consortium in Africa. There is one in East Africa. There's another one in East Africa for climate and health specifically, commissioned by Wellcome Trust. So it's a huge investment in Africa right now. But so there is a health and environmental triangulation data gap that's also being researched into. So it depends on if you want to get how does it affect the people, if you want to get the core side of things, or if you want to get the policy side of things, right? So I think researchers prioritize based on their need, prioritize based on the funding available, really, right? And they also prioritize based on what they have capacity to deliver. So if you ask me where do I see the biggest evidence gap, I've showed you where I see the biggest evidence gaps, right? But I cannot say how should they prioritize. I only gave you that these are key things that affect prioritization, right? Prioritization affected by what research capacity do you have? For instance, can you conduct the research to show how heat affects the quality of a breastfeeding mother, right? How does heat stress affect a breast milk, for instance? How does it affect the healthcare workers sweating at the facility? What does that do to the protein released at their bodies by certain times in the day? Can you run a cohort study for like a period of time to like estimate that? Would you have that capacity? I think that's one thing that researchers should think about, right? Beyond thinking about that, that will cost a lot of money. So you have to also think about the funding for that, right? While you're also thinking about the funding for that, do you have what's it called? Do you have like a gap that will pick this up? If you do this research, is it just going to be lying down there? Are you going to dump it or you're going to take it into action? So these are some of the things that should help prioritize like where the research should be happening in Africa. So I think we need to do a lot of costing, right? We need to be able to tell. So in terms of costing, Setunji mentioned that they're able to make some predictions now, and they're able to like tell about some modelings and anticipate where there's going to be like an increase in malaria, for instance. So I would say that you can also do simulation modeling, right, for health facility. If you are modeling health facilities, what will happen if we change the roof for a 6-month period? How would that reduce the internal temperature of a health facility? What will happen if we do that for a street? So you can do simulation modeling for some of these things, right? So that's also an area of research to consider, right? What would happen if we plant trees? What would happen if we, what else? What else do they do? Yeah, they do mitigation, they do adaptation in those two categories. What will happen if we do this action before going on to invest or commit long term in any of these things? I think these are some of the things that I think can help. I hope that answers your question, Salimata Deara, in the chat. Thank you.
All right, amazing. Thank you so much, Martins, for that. So I'll also just continue with you as we wrap up. We've spent the last 60 minutes just talking about climate change, health, digital innovation, resilience, and of course, you all have talked about the fact that it's not just about the technology. Technology of itself is an enabler, from what I've picked from most of the conversations we've heard today. The real opportunity is to connect our data, to have a stronger surveillance system, to put in the right indicators, as Martins has mentioned, the appropriate technology, and also to skill up our health workers and young people towards having a responsive health system. So to all our panelists, starting with Martins, what is one action you want us to take from this discussion? And if Africa should take one action in the next 12 months to become more climate ready, what will it be?
That's a very tricky bet, but let's make the bet nonetheless. So if there's anybody here on this call who can do something about it, who is listening, I think if I mix matching all the things that have been said by myself, Satunji, Francis, and Aloy, I would say that we do need an updated geolocated facility register, right? We do need that somebody is actually maintaining, so that we cannot just say, oh, we have 3,000 health facilities, but it's geolocated. Then beyond that, we can then say, all right, let's work up a standing agreement with the people who have this geolocated data, and to say, let's connect their API into one of these DHIS that we're currently using. I know there's a DHIS2 climate health app that has been piloted before over a number of time. And I also know that there's currently funding that was recently released to expand that from the Wellcome Trust. I think that was like 2 days ago, right? Wellcome Trust released a huge amount of money to like DHIS to increase their repo for like the data interface in that direction. I also think that as opposed to doing like the monthly reporting that is happening, we can now start doing sub-monthly reporting. That's just a step lower than the monthly reporting. So you don't have to wait to the end of the month to be able to like pull out what's happening on DHIS2, right? Then within that same space, you can have the health data, the environmental data, and the weather data all triangulated, really. So if you can have all of this, you can then add humidity and all of that. Then at the end of the day, let's have agreed definitions, right? Let's have agreed outcome definitions. Back to my earlier point to say, all right, we are all defining a new set of words that if somebody is sick as a result of heat-related illness, let's be able to call it heat-related illness, right? Or heat-related mortality. Let's come up with some of these words and all of that, right? Let's do this cross-learning in this area, right? So that would be my recommendation if we're going to like move the pace in Africa. Thank you all for listening.
Thank you so much, Martins. We're documenting all of these recommendations as well, as we also would continue to push and advocate for all of these points you have mentioned. Dr. Francis, over to you as you give us your closing.
Yeah, okay. So I've had the benefit of listening to the conversation for a long time. I would want to make 3 points, three points that I think are action points. One is in terms of capacity building. I've had the privilege of not just the development, but also building capacity and mentoring in a typical university setup and also in research and consultancy setup. One of the ways, especially when you think about where we are with the AI and stuff, a curriculum that will take 4 years for a student to finish, potentially by the time they finish, the technology will have changed. So now we have to have a way of students learning on the job. One of the things that we've done is when we have a project, we embed students on the project so that they are able to learn on the job and do practical things that are needed now. And of course, now also there are lots of hackathons that are going on and students are really benefiting and gaining from this. So these have to go on even as we do our work. I think one of the things that we've also done at ARIN is particularly fellowships. And this is related to the question that was asked about for public health professionals. For people who are already into practice, ARIN provides fellowships where, for example, if it is AI, you may be a public health worker, you may be a policy maker, but then we provide self-paced learning and in-person fellowship programs so that you are able to learn even as you continue with your job. The fellowship also comes with mini grants so that you can come up with a practical question that you are addressing currently and are able to pursue it as part of that fellowship. Number two, I think, is in terms of prioritizing, and I'll go back to my geography point that I had at the beginning. We have to be able to prioritize based on the geographic links between climate and health. So, for example, in East Africa, the priority diseases have been documented. So it means the research and action really has to focus on that because of the resources and because of just where we are. And then the third thing that I want to speak about, as we speak about research, as we speak about action in climate and health, it is normally we, the experts, it is normally we, the elite, if I will call it that, who are having this conversation. But the people who are really affected by climate issues and health issues, we kind of ignore them because of the assumption that they don't have the technical skill and the capacity to understand the big models that we are speaking about. But I believe these local level people have historical knowledge, historical experiences. So let's now leverage on the good of the AI and the good of technologies to provide these people with a means of being part of the solutions to the problems that they really are facing. I think that is what I would want to say. Let local communities, let individuals, however language they speak, be part and parcel of finding solutions. So in terms of the research that we should be also doing now is a research that integrates communities into finding solutions for climate and health questions. Thank you.
Thank you. Thank you so much, Dr. Francis, for that profound closing remarks. Setonji, over to you.
Yeah, we'll make it really short. Cooperation, and we should use the data. So cooperation means we work with all the institutions that we have, and using the data just means harmonizing. My colleagues already said that. Bring the data together, make inferences from it, and use it exactly for this whole discussions that we are having. So I would close with that. I also do not want to take too much of the time of our people that we have here. Thanks.
All right. Thank you so much, Setonji. Then Alois, you can help us close this up nicely.
Yes, thank you very much, and I appreciate once again the Africa Digital Health Africa for organizing this and partners. I also appreciate everyone who has been on this conversation since the week began, and I encourage each of us to continue engaging in the conversation for the sessions that are coming up, I think, tomorrow, and to keep thinking through and doing beyond thinking, to keep doing, whether it's research, whether it's innovating, whether it's business, anything that we find viable doing at our own hands to ensure that we future-proof the future and the communities that are more resilient, that are more developed, that are more healthier in our content. We have the capacity, we have the resources, we have the people around us, and we have every reason to decide how to do it. Let's do it together. Let's foster stronger partnerships among young professionals to ensure that we achieve the success of the Africa that we want. Thank you very much, and back to you.
Thank you. Thank you so much, Alois. And with that, we'd like to say thank you to all our panelists. Thank you so much for your contributions, for the key insights you've shared today. So many things we have noted down from all the recommendations and discussions we've had today. And for us at Digital Africa, we are also calling on international partners and cooperation on climate and health, that Africa, you can't be treating Africa as a case study. you have to treat Africa as a co-architect, of the standards, the financing mechanism, and also the digital infrastructure that this moment demands. We're already doing a lot, at least from the evidence that Setonji shared, from what Martins is doing from the research angle, from the capacity building, Aaron and Alois are also doing. We're already doing a lot, and we are moving the needle. So we would like to call on more partnerships, more funding to move this work forward. And because this is the spirit in which we convene this week, and we keep showing up even tomorrow, as Alois mentioned, to keep advocating for a resilient health system during this changing climate. So to GIZ, to the team, to Aaron, to Martins, to Dr. Francis, to Setonji, to Alois, to every one of you who have joined us today, thank you so much. And we're really excited to launch our call for application for the Top African Climate Health Innovation. We'll be recognizing young people or innovators, researchers who are building innovative ideas in tackling these climate-related challenges. So the form is now open. Please do share. You can scan the QR code to nominate somebody, or you can nominate yourself. And what we do is to spotlight you, and also to share some of these, some of your work with potential partners and funders who can support you to grow that particular idea or project. And this is our own way to also keep the conversation going around climate health innovation. All right. Thank you all. Thank you so much for following us. Let's keep up the good work, and let's keep advocating for a healthier, climate resilient Africa. You can rewatch the recording on our YouTube channel. And also, please stay connected to all these partners. They have amazing opportunities, as I know Dr. Francis mentioned, fellowships within Aaron. So if you're a young person, please follow them online, on LinkedIn, on Twitter, as well as Amplify Health and Development Africa, where Alois also works. And also keep following the work GIZ is doing around One Health data. And you can also contact any of our panelists if you have more questions or any other opportunities you'd like to share with them. With that, I would like to say, please do enjoy the rest of your Friday and have a great weekend. Thank you all. Bye.
Thank you.
Thank you. Thank you so much. See you next year.